And now, Right at Home, In-Home Care and Assistance, and WRMN AM 1410 present Silver Solutions Radio.
Good morning, everyone. Welcome to Silver Solutions Radio, your show for living long and aging strong. We're bringing this show to you because we're passionate about helping people, especially our senior and disabled communities. Hi, I'm Jim Wojciechowski, and Jeanette and Kathy are not with us today. So I'll be running the show, trust me. So you're listening to WRMN Radio, AM 1410 on your radio dial right here in Elgin. This is your show. We encourage you to call in with any questions or comments at any time. Let me give you that number. The number is 847-931-1410. That's 847-931-1410. Our show is brought to you by Right at Home. The 4 pillars of right care from Right at Home mean your loved one is being cared for by the right people, doing the right things, the right ways, for the right reasons. Make the right choice today. Call Right at Home at 877-ELDER99. That's 877-353-3799. Well, again, good morning on this sunshiny, cold April day. Our guest today is Jory Gustafson Langlois. Jory is the clinical liaison for Presence Health Outpatient Rehabilitation. Now, aside from sounding very important, and she is, everybody knows we have coffee every Tuesday before the show, and she has a very important job. She's an especially important person to know because, let's say, you have left the hospital after surgery, after an injury or some sort of surgery. She's going to be one of the people in charge of getting you back to where you were physically and mentally. So, Jory, welcome to Silver Solutions Radio.
Thank you for having me on the show, Jim.
Can you take a couple minutes and introduce yourself to our audience? Tell us a little bit about yourself and what you do as a clinical liaison for Presence Health.
Yes. Again, my name is Jory Gustafson Langlois, and I work for the outpatient rehab facility for Presence. I am the clinical liaison, so I am able to meet with patients over at the hospitals in order to let them know the services, what we have to offer, as well as dealing with people outside the patient as well as the family. And I meet with a lot of physicians as well and see if they have any patients or orders, what we call, in order to get somebody started for physical, occupational, or speech therapy.
Very good. So you're one of the main people, the main contact points for Presence outpatient physical therapy.
Yes, I am.
Okay, very good, very good. We're going to get later on in the show to your contact information.
Okay, great.
Now, where are you located?
We have many locations, but the 2 closest to this area would be the Medical Office Building 1 at Presence St. Joseph Hospital. The address is 87 North Airlight Street, Suite G14, and of course that's in Elgin. And the other closest location would be out of the Presence Family Care Center at 2201 Randall Road, and that is in Carpentersville.
Oh, very good. Now you had mentioned there's other locations?
Yes, we have quite a few locations throughout the United States.
Oh, throughout the United States. Okay, but those are the main local ones.
In this area, yes.
Very good.
We have other local ones, and Aurora and Joliet would probably be the 2 closest ones besides.
Other closest ones.
Yes.
Very good, because WRMN goes as far as the nation and the world, by the way.
And the world with that app, you bet.
Okay, very good. So Joliet and Aurora would be the other 2 local locations.
Yes.
Okay, very good. Okay, very important to know. Jory, tell us a little bit about, can you describe what your ideal patient would be?
Yes. Our ideal patient would be a patient who would be able to travel to one of our locations for their therapy needs, such as physical, occupation, or speech therapy.
Okay.
And is that offered if somebody can't travel? Is there, what do they do if they can't travel to you?
Oh, that's a commercial for me.
See? There you go.
Okay, very good. Actually, there are several services out there. Right at Home provides a transportation service along with, I know a lot of your townships. If there's, not too big of a physical or lack of physical capability to get in and out of a vehicle, but there is other transportation services out there that even do. And if you need information on that, you can also call Right at Home. So,
And I'm going to guess you probably help facilitate that anyway for them on how they might be able to get to your service. Correct?
Yes, we have a list of services, transportation services that we could provide to someone to call and schedule their appointment.
Beautiful. So Jory can help you out on that. Is there a certain age requirements, restrictions that you can accommodate?
Yes, it does depend on the diagnoses of the patient, but we could accommodate grade school patients all the way up to seniors.
Okay, very good. And, we usually, as we age, we see a lot of seniors needing physical therapy. Jory and I were talking about that this morning, that we're on a quest to get healthy and things like that. But what is unique, I think, is your lower end of the age spectrum.
Yes, depending, of course, on their diagnoses and the therapist. Many of our therapists also have specialty training as well when it comes to certain age groups or certain diagnoses. So we are very lucky that we could accommodate the younger population as well.
Okay, right. Yeah, that's very important. I'm thinking of everybody that, all these kids in sports today.
Exactly.
Okay. And a question on that: does outpatient treatment cover sports physical therapy?
Actually, they do, and I was going to talk about that.
Oh, a little bit later
yes.
on. Okay, so I jumped
the gun. That's called a teaser.
That's a teaser. There we go. What payer sources, and this is very important with all the changes out there today, in payer sources, and we were discussing a little bit about one this morning. Can't mention it yet, but what payer sources do you accept?
We accommodate a wide variety of payer sources, many different insurance companies, including commercial insurance companies, Medicare, Medicaid, the managed Medicaids, as well as the managed Medicares, and MMAIs, the dual eligible policies. We just covered tons of insurance. We have contracts with tons of insurance companies.
Okay, MMAIs. What does that mean?
That is the dual eligible when somebody who has Medicare and also a Medicaid policy.
Oh, okay. Okay, and that's very important. So basically you cover any sort of commercial insurance is covered on this. And all of them have to have some sort of doctor's order, I would think.
Yes, we do need a doctor's order on every patient who needs physical occupation or speech therapy.
Very good, very good.
And we work with the doctors. They're very knowledgeable themselves, but in case we do need a certain order or the patient does talk to the doctor and doesn't exactly know what kind of order, we can always educate both the patient as well as the doctor. Not saying they're not knowledgeable on it, but we do speak with many different doctors on different orders.
And I would think as you're providing treatments too, some things can come up to that you might be able to help educate. Say there's something one of your physical therapists see. You could get in touch with the doctor and say, hey, we actually need to expand this or extend this. Yes? Yes,
and that's not uncommon. The therapy department, whether it's physical occupation or speech therapy, they initially do an eval on the patients. So we could still have the doctor's order stating a patient needs physical therapy only. But once we do the eval and we see, this patient can also benefit from occupational therapy, it's not uncommon for one of the therapists to call the doctors to discuss it with the doctor and then have the order revised or another order written out for any other therapy what they think the patient needs.
Oh, yeah, I'm thinking we're all connected. So as you're getting into physical therapy, something else starts happening that a doctor didn't pick up immediately.
Well,
That's a very important aspect of having your physical therapist there.
Yes, it really is very important.
Well, it's almost like physical therapists and occupational therapists have more of a hands-on, no offense to doctors, but they're treating with what that illness is at the time. You guys have the all-around big picture that you can recognize that.
Right, and that's kind of where I was going with that. So, and I'm thinking to myself, every once in a while, I pick on a injury. By the way, I gotta encourage everybody: don't get old. Okay.
Good advice.
Okay. Because as you do, you start, the pains start happening. You bend over the wrong way. I just went through that, and I'm going, oh, hold it. That was I never felt that before.
And it starts in your 40s, everyone.
Okay, very good. So, yeah, my father always used to tell me that. I didn't listen to him as usual. Okay. So let's get in to some of the specific therapies that you guys have.
Well, the types of therapies, what we do offer, as I was saying, are physical, occupation, and speech therapy. We have 8 physical therapists, 1 occupational therapist, and 1 speech therapist out of the 2 locations, Carpentersville and Elgin. We have lots of different specialty therapies. I'll just go over a few.
Absolutely.
One is balance and vestibular rehab. This would help a patient who is experiencing dizziness or balance problems.
Okay.
And some of the diagnoses that would go along with someone who would need this type of therapy would be someone with vertigo, stroke patients, someone who has Parkinson's or MS, just to name a few.
And that staying physical is very important for those 2, Parkinson's and MS. Just keep on moving.
Oh, yes. It's very important. I ended up with vertigo not too long ago, unfortunately, and it was one of the worst feelings ever. I ended up seeing a therapist for it just because my balance was so off, and it has to do with something in the inner ear.
Oh, okay.
But
it's awful.
Oh, it is. I think I was out of commission for about 3 days. It was horrible.
Really?
I had to wrap sheets around the steps going downstairs because I worried like I'd be walking, and so I did that so you wouldn't be able to fall. But I mean, those are little things that you have to adjust to.
Yes.
And the therapist can help with that.
Yes.
Okay.
Yeah,
I didn't know that.
Some of our therapists specialize in it.
I'm thinking of my daughter. My daughter today. My daughter's 39. Yes, 39. I didn't say 40.
Good puppy.
My daughter's 39, and she just the last couple of years, actually, since she had her child, has picked up some sort of what I'm thinking is a vertigo. So physical therapy can possibly help that.
Yes.
Wow.
Yeah, I'll be sure to give her my number.
I say we
when-
learned.
I'm going to give her your number. Okay. Very good. So let's go ahead and continue on.
Sure.
On that.
Another specialty program we have is for COPD patients. And we could help those types of patients when it comes to mild or moderate breathing issues. They might even have some difficulty walking with their oxygen tank. And quite a few patients we know have anxiety or fatigue with activities of daily living that we could help with.
Oh, sure. Okay.
Another great therapy that we have to offer, it's called Graston therapy. And it's a technique in which incorporates instrument-assisted massage to effectively detect and treat scar tissue and restrictions that affect normal function of daily living activities. And some diagnoses that would benefit from this type of therapy would be someone who has carpal tunnel, maybe neck, knee, or foot pain, someone who might have scar tissue. Even post-mastectomy patients could benefit from Graston therapy.
Can you describe that a little bit? What do they do? Is that more of a massage type?
It is more of an instrument that would be massaging a certain part of the body.
Okay, so to basically soften the tissue?
Exactly.
Or, soften, warm it up, help stretch it out and stuff like that. Of course, that would be... after you warm it up, there's probably some physical therapy to help do that?
Yes, there is. And at the end of the talk show, I will be giving our phone numbers if you need more information. Of course, you can always go on our website, but I would give you phone numbers to both of our closest locations, and we could get more information for anybody who would need it at that point.
And I can absolutely feel this. As I'm aging, my fingers aren't moving the way they used to. I'm a fisherman. My wrist. All of a sudden I'm getting this pain in my wrist. I'm going, what could that be from? Well, as many casts as I've made, maybe I need to come to see you.
You might, because we also have a specialty program for that.
Oh, let's talk about it.
He just sat up straight.
We have a hand therapist who is specialized in hand therapy, and it's a treatment to regain functional movement of the hand, wrist, or elbow following some type of injury or medical condition. And that would be a perfect example when you're having the pain and issues where you're not able to use it as much as you used it in the past. Carpal tunnel would be another one, arthritis, or any type of traumatic injury to any part of that area.
I think that's fantastic. So is Graston a new therapy?
No, it's been around for a while. There are different techniques when it comes to that, but we use the Graston technique.
Okay. Now, we kind of covered, let's go into a little bit more who would benefit from these therapies. And let's just kind of go down the line. Speech therapy.
Speech therapy would be someone possibly with speech or swallowing issues, or even neurological disorders.
Okay.
Some other diagnoses that would benefit from physical or occupational therapy would be someone with back or neck injuries, industrial injuries, which that was something I wanted to talk about as well.
Let's talk about those.
Okay, great. We have a functional capacity evaluation that is done out of my Carpentersville location. And it is a test for a person to determine their ability to perform work-related tasks to determine in what capacity a worker can return to work.
That would be very important.
Yes.
Okay. Can you give an example?
Yes, possibly someone who is applying for a job, and the company wants to make sure that they are able to do whatever.
Oh, the company could fund that.
Yes. As well as if somebody were to get hurt on the job, we could accommodate them, get them back to hopefully where they were prior to getting hurt with a work conditioning program. And that is designed to prepare the injured worker to return back to work. Someone who might hurt their back, maybe have low back pain, a post-fracture, or even a strain or sprain that someone acquired, we would work with that person in order to get them back to where they were.
Very good. This is, you just made an interesting statement. I know Leah picked up on it. So a employer could use presence to basically, if there was a physical part of their job that they wanted to feel comfortable doing, like a lot of back work, you guys can assess somebody like that, yes?
Yes, we can.
Well, it's very smart. In the long run, that's a smart thing for an employee to look at, to look at, to make sure somebody's either ready to come back to work if they've been out because of an injury, and make sure that they're able to handle the duties.
Right.
And then to confirm that somebody is able to take those on upon hire, too. So that's great.
I'm thinking
you don't think of that in that arena, right?
And you don't. That's why what excites me, being a business owner, that's one of our biggest concerns, even for caregivers, that maybe somebody is suffering because we do a lot of lifting and things like that. This is a service that I wasn't aware of. I think think it's an excellent service to help, because our employees are the most important parts of our business.
So true.
Okay,
So you've got like a staff of what, 8,000 that does all this?
Yes.
That's a lot of stuff. That's a lot of stuff that you.
Well,
do.
yes, we're very blessed and able to do many different types of therapies and the extra training that goes involved with our staff members, my coworkers, to make sure that they're certified in order to do these therapies as well.
That is, and I hope we have a lot of companies listening out there today that this service is these services from Presence are available for you. So we'll give that contact information in a few minutes here. But if you're listening, something to consider. How would someone go about scheduling an appointment with you? Can they do it privately, or is this something a doctor does?
It's mostly the patient is responsible to do that, but more importantly, the patient needs to talk to their doctor, maybe have a doctor visit in order to determine what type of therapy is needed, because we do need an order from the doctor stating what type of therapy and what the diagnosis is. Once we have that, then the patient can call our Carpentersville location, and their phone number is 847-844-7800. And my Elgin location is 847-695-5904. They could call those numbers to schedule the appointment, as well as get more information on any therapy services that they might be interested in receiving.
Okay, so this is something that, so somebody, and I hope the audience understands this. If you have a physical issue right now that you're wondering about, see your doctor first.
Definitely see your doctor first.
Okay. Now, can the patient say, you know what, I heard of Presence Outpatient Physical Therapy. I am in their area. I love Jory. Is that something they can request from their doctor? Do they have that choice?
Yes, they can request it. The doctor does have the final say. They want to make sure that they're doing what's best for the patient. And once they have that, or even if the patient were to call one of our departments, we would suggest for them to also either call or see their physician as well. But we could help the patient do that. We could also call the patient's doctor if they were seen recently and give suggestions from what we know from the patient, just from over the phone conversation, but the doctor has the final call on what's needed for the patient.
And I would assume that's probably necessary for insurance purposes anyway.
Yes, it is.
And I would have to think so too, but very important, because I like to control my own destiny. I don't like anybody telling me what to do. So and I try to go on Google and find out what's wrong with me.
I know, Dr. Wojciechowski.
Okay, so Jory encourages you to make sure you call your doctor first. Now, what if they were going to they were in physical therapy? Say they were done with physical therapy, and say 2 weeks goes by, and they're still having issues. Again, call the doctor, or can they call you?
They could call us, because we could ask the doctor to write another order. Sometimes the doctor might want to see that patient to see how the progress is going themselves, but we can make the phone call for the patient.
And that's very important, because you really start building a relationship with these people that need the help, especially the physical therapists, and let them help you.
Exactly.
Okay? Because this is I encourage you, just like a doctor, okay, it's a long-term relationship. And we always talk about building a team as we're aging. This is a perfect example of building a team. So go to people like Presence that you like to work with, and stay with them, because they start learning what's going on with you personally.
Don't wait until you have to. You know, I mean, sometimes a little pre-planning is the best you can do. Don't wait until you are in that situation where, you know, you have to make a decision. Good to know you have that as a choice or selection, but sometimes it's kind of wise just to be prepared, especially as we get older.
Absolutely. Now, Jory, is there a certain situation where you've seen physical therapy just work miracles? And if so, can you give that example?
I see it all the time. Our therapists are wonderful. They're all about the patient. They do what's best for the patient. And I have not worked for a better group of people ever since I've been working. I could honestly say some of the therapists, they do form that relationship. Actually, all of them, they do form that relationship where they not only get to know their medical condition, but they're with the therapist anywhere from 30 minutes to 60 minutes, and you get to build that personal relationship as well. And our therapists are very encouraging when it comes to the patients. If we're working with physical therapy on one of our patients due to back pain, for example, we push them a little bit more. I shouldn't say push. We encourage them.
Encourage is a good word. Because
we encourage them a little bit more to do what they need to do in order to make sure that they feel comfortable. And sometimes a lot of patients, they do need that encouragement. They might have anxiety issues along with whatever their medical condition is. And just having a therapist work one-on-one with a patient does wonders for many of our patients.
And, you know, that is makes perfect sense. And, you know, that's wonderful. Anybody in the healthcare arena is there for you. It's a matter of a heart. You know, Jory and I, again, have talked this morning. You have to have a heart for helping people. And that is that's part of what we do. Jory, could you do us a favor? Can you give all your contact information again?
Yes, I definitely will. We have 2 locations nearby. One is in Elgin out of the present St. Joseph Hospital Medical Office Building 1, 87 North Airlight Street, Suite G, 14, and that's in Elgin. The phone number there is 847-695-5904. And then we have our outpatient rehab at Presence Family Care Center at 2201 Randall Road, and that's in Carpentersville. Their phone number is 847-844-7800.
Jory, thank you for being our guest today. Thank you thank you and your team for what you do. And by the way, after physical therapy, do what you need to do at home too.
Exactly. Okay. That's key.
That is key. Okay. Are you compassionate? Are you one of those angels that just love to serve people? Kind of like us. Right at Home is looking for you to be one of our caregivers. Apply today at rightathome.net. Don't forget, our show is brought to you by Right at Home. The 4 pillars of right care from Right at Home mean your loved one is being cared for by the right people, doing the right things the right ways for the right reasons. Make the right choice today. Call Right at Home at 877-ELDER99. That's 877-353-3799. Don't touch that dial. Stay tuned for the radio shopping show right here on WRMN AM 1410. See you next week at 9:30 on Silver Solutions Radio.
You're listening to WRMN 1410 Elgin.